DW Africa Link.
I know what I'm about to say might shock or surprise many, but did you know that in most parts of Africa, a patient's first response to illness is not a clinic visit, but some herbal solution? Even as governments invest in modern hospitals and important pharmaceuticals, traditional medicine remains deeply rooted, trusted, and widely practiced. However, the divide between the two systems is becoming increasingly difficult to ignore. Critics argue that unregulated traditional practices can endanger lives. Advocates counter that modern medicine often overlooks cultural context, access, and affordability. But the Ghanaians in downtown Accra are undeterred by critics.
The herbal medicines to the orthodox medicines. The reason is that there are a lot of speculation that orthodox medicines usually do not cure the ailments that are sent, especially with the degenerative diseases like hypertension, the diabetes and all that. But there are some herbal medicines that can treat those conditions. And then also people have orthodox medicines tend to harm the kidneys and the livers and all that, but the herbal medicines, most of them being organic.
I personally prefer the herbal medicine to the orthodox medicine because the orthodox medicine is like it's made in a synthetic form, so it can't eliminate the disease itself.
I prefer the herbal one when I come home. It's a natural, it comes in natural source. So.
In this episode, we explore the potential harmony between traditional and modern medicine in Africa's evolving healthcare landscape. Who gets to decide what counts as credible care, and what does the future look like when centuries-old knowledge meets 21st century science? Stay tuned. My name is Josey Mahachi. Welcome to Africa Link, the podcast that connects you to the stories that matter from and on Africa.
Africa Link, every weekday here on DW.
Across the world, nature-based remedies, plants, herbs, and spices have long played a role in healing. While modern medicine has become the dominant form of treatment, traditional practices remain deeply rooted, especially in parts of Africa. The World Health Organization acknowledges their value, noting that up to 40% of essential medicines originate from plants. Yet concerns persist. Misidentified plants, improper preparation, and unregulated use pose real risks. In Ghana, efforts are underway to bridge the gap. The country is training herbal practitioners to produce standardized, clinically sound herbal medicines. Now, in this episode, in a conversation with Dr. Daniel Boamah, Deputy Director at Ghana's Center for Plant Medicine Research, and our own DW correspondent, Adwoa, Tenkoramaa, Domena in Accra, we explore how indigenous healing and modern healthcare can coexist in Africa with a focus on Ghana. Daniel, I want to start with you as our health expert. If you can just briefly describe the current healthcare landscape in the country, particularly the role traditional medicine plays alongside modern healthcare.
Thank you very much. So in Ghana, currently, healthcare landscape is evolving. Over the year, the government has put in measures to improve access to healthcare across the nation. For example, we have the University of Ghana Medical Center, the CHIPS compounds scattered all over the country. However, traditional medicine is also playing a significant role, with many Ghanaians relying on it due to cultural beliefs, accessibility, and affordability. So a lot of people are these days opting for herbal or traditional medicine.
Mm-hmm. And Adwoa, you are our eyes and ears also on the ground as a reporter. What does the healthcare landscape look like in the country from your own perspective?
So for me, I would just buttress on whatever Doc has said is evolving. And recently, the WHO released a report that talks about how the healthcare outcomes in Ghana is at par with some of our peers in the sub-region. So you talk about Nigeria, you talk about Senegal, you talk about Sierra Leone and all of the other countries surrounding us or in Africa. To answer this specifically, I'll just break it down into 3 parts. So you have the structure, you have the functionality of the health system, and then you talk about the accessibility, which Doc mentioned as well. So for the structure, you realize that the Ghana health system is largely built around political administration. What does this mean? So governments come, government go. You find that some policies are changing. So for instance, the previous administration came into office with a policy that targeted non-communicable disease. So for instance, kidney patients will have free dialysis care. That was a policy of the government. This government has come into office and it is also introducing the Mahama Cares, which essentially seeks to target non-communicable disease and provides subsidized or affordable health care for them. But we have the decentralized health access, which is the national health insurance that everybody, regardless of your financial muscle, is able to access. So for instance, if I'm in the village in the eastern part of Ghana, and if I'm in the Greater Accra region, we all have the same access to healthcare if I have registered onto the National Health Insurance Scheme. But when I say it's largely built on political, so you have the health ministry, which is manning the entire country's health system. It has partners and agencies like the Ghana Health Service, and it uses that to, regulate how health is administered in Ghana. When you talk about the functionality, it's mixed depending on who you're asking. So for instance, in Ghana, there have been a lot of breakthrough health interventions or breakthrough health, or maybe doctors performing surgeries for the first time. So in 2019, for instance, there was the first heart surgery done in one of Ghana's biggest referral hospitals in the Ashanti region that did a heart surgery without opening the heart of the patient. So usually we have the open heart surgeries, but this time around, they were able to perform a surgery without necessarily opening the heart of the patient, which was the first time. So for me, one of the critical things that shows that a system is evolving is that the things that we could not do before, now we are able to do that. So that is the functionality for me. And on the access, just like Doc was saying, it's a bit difficult to access healthcare if I'm in the rural area. We have CHIPS compounds, we have health centers, but in the district, in the regions, you have district hospitals, you have regional hospitals, you have private hospitals that have the facilities, that have all the modern technologies. But if I'm in the rural area, for instance, and I need a surgery, I'll have to be referred to a hospital that's perhaps miles away. So the accessibility for that part, becomes a challenge for me. And so that's why you find that a lot of the people in the rural areas will rather depend on the things that are available to them readily. So you find that a lot of people also do self-medication because getting to the hospital may be challenging in terms of access, in terms of even availability of health professionals, especially in the rural areas. You find that people refuse to go there when they are being posted because there is that challenge of working conditions. And so you find a lot of the doctors and the nurses largely centralized in the capital or in the large cities, when the rural areas do not necessarily have the health professionals to help them. So maybe in a CHIPS compound, for instance, you have just one doctor serving about 7 or 12 communities. And so it becomes, so people would rather go to their backyard, fetch some herbs, boil them as their grandparents or their mothers have taught them, instead of relying on the modern healthcare or the hospital system. So that's largely what I would say about the healthcare system. Josey.
Right. Adwoa, just also to find out, how do these two coexist, traditional and modern medicine, in everyday life in Ghana?
So in terms of coexistence, you find that the state or the government, and I usually take things from the policy aspect because that largely regulates how things are done. So you find that the government of Ghana has a recognition of traditional medicine. So there's actually a policy document on traditional medicine that guides essentially the country's approach to traditional medicine. So the main goal of that is to sort of integrate traditional medicine into our healthcare system. We have a situation where a lot of people who came before us, say our grandmothers, our great-grandparents, rely heavily on the traditional health system. Now, health system is evolving. How do we bring them along so that we have a complementary nature of traditional and the modern healthcare system? So this has led to the setup of some agencies and institutions, like the institutions for Dr. Boamah, for instance, the Center for Scientific Research into Plant Medicine. They do specific research into medicine and look at, the approach, the dosage, and how to make the sector essential. There's also a unit at the Ghana Health Service, I think, called the Traditional Medicine, which is now Traditional and Alternative Medicine Directorate. And then we have associations, for instance, the Traditional Healers Association. So to a large extent, the nation recognizes traditional medicine as a mode of healing.
Let me just quickly ask Doctor also, before you touch on the next point, Adwoa, for him to maybe tell us the most common types of traditional medicine used in Ghana today.
So in Ghana, the most type of traditional medicine used is the herbal medicine. And a lot of people are getting into herbal medicine because it's easily accessible and it's cheaper. And also there's the belief that has less toxicity. And also people believe in it because it's terrible. So herbal medicine is very common in Ghana. In addition to that, we also have the spiritual healing, where people go for spiritual healing in the churches, in the mosques, in the traditional settings, in the shrine and all of that. And we also have in these days, we are importing foreign traditional medicine. For example, the homeopathy, acupuncture, massage, Ayurvedic medicine, and also most importantly, the Chinese medicine. A lot of people are importing these cultures of health care into our system. So we have all these systems happening in Ghana, especially the herbal medicine. And also the FDA plays a role in regulating these things. So basically that's what's happening in Ghana now. Herbal medicine is really on the high scale these days.
And from a medical standpoint, Doctor, what are the strengths and limitations of this traditional medicine? And are there any traditional remedies that have been scientifically validated or integrated into modern treatment protocols?
With the strengths, at the medical standpoint of view, we have the potential therapeutic benefits of these herbal medicines, and also the cultural significance. These practices are rooted in the cultural significance or cultural practices, and therefore beliefs and people's understanding of culture is also significantly integrated into herbal medicine. And this cuts across all over the world. And also community-based care. People have access to it at the community level. As she mentioned earlier, it's easy for people to have access to it. And then generally, as indicated, people believe that these herbal medicines have limited side effects. And when it comes to limitations, we have lack of standardization. Sometimes they take 1 cup of this, take 3 leaves of this, as compared to the orthodox medicine, where measurements have taken place and they know how much is therapeutically effective. And also potential toxicity, if not used with the right care, people may have toxicity, poisons, and all of that may come in. Now, the government of Ghana has put in a lot of measures to integrate these two systems in place. So we have the herbal medicine being integrated into over 50 main healthcare streams in Ghana. And when you go to the such hospitals, you may opt for the traditional herbal medicine session, or you may go for the orthodox medicine session. And this is making it easy for people to have both systems accessible to them. And this is in a way helping to improve healthcare accessibility of Ghanaians across the country.
Now, before I turn to Adwoa, Doctor, still with you, you've mentioned some of the main health risks associated with these unregulated traditional treatments. Now, but how is the Ghanaian government then working to regulate or standardize traditional medicine practices?
Mostly it's done through the Traditional Medicine Practice Council, that's the TMPC. And the TMPC has a lot of functions or a lot of regulations. And this is done through the Act, that is Act 575 of the TMPC Act. And they do this through regulatory framework. So it operates under the Ministry of Health and is mandated to regulate traditional medicine practice, including registration, certification, and license of practitioners and facilities. So TMPC registers and licenses all these practitioners and their premises. And also, it ensures that standardization is in a way taking place among these practitioners. So it develops protocol, it develops review standards for traditional medicine, ensure quality and safety, and also provide them with code of ethics, and also conduct public education and collaboration with institutions such as Center for Plant Medicine Research, FDA, the Ghana Journalists List Association. These are there to help promote safety in herbal medicine. So standardization is very important in traditional medicine practice. For example, when it comes to Center for Plant Medicine Research, they carry out a lot of research into herbal medicine, where clients bring his or her product to the institution. They do conduct a serious scientific research into that and provide the safety, the efficacy, and even the formulations. And this helps them to properly standardize their protocols or standardize their the product for people to use. So without this being in place, this herbal medicine will just continue to be unstandardized, create a lot of problems for people, not forgetting what they do sometimes works well or sometimes may have adverse effects on patients. So it's important that it is put in place. So government is putting all this effort through these regulatory bodies, the TMPC and the FDA, and then the science bit is the being performed by the Center for Scientific Research into Plant Medicine or the CPMR. So these are very important in the country.
And Adwoa, now coming to you, I know what the process of visiting a clinic, a modern clinic or a hospital, but I just want you to describe a typical visit to a traditional healer or herbal clinic in Ghana. You know, what are the general attitudes among Ghanaians toward this traditional medicine? Do they see it as outdated, complementary, or essential? And if you've also noticed a trend of maybe generational differences in how people view and use traditional medicine in Ghana.
That's a packed question. So for a typical visit to a traditional healer or a herbal clinic, you essentially go through the same processes where you go through consultation, you go through diagnosis, and then you go through prescription. The difference may be that in a modern setup, you go through the nurse, your documents are taken first of all, you go through the nurse, which takes your vitals, then you go to the doctor, they'll run some tests for you, and then they'll diagnose you and then prescribe medication. But in the traditional setting, just like Doc said, there is no formula of how diagnosis is made. So for instance, it can be done through observation. They will observe you, some of the symptoms you're presenting, or they'll sort of measure your pulse or monitor your pulse to see what exactly is wrong with you. And with the prescription, for instance, the major challenge for which reason a lot of people are skeptical about using herbal medication is that you do not know, one, the composition of all the herbs that have been made into the medicine you're getting. The number two is that in terms of dosage, you don't know if, okay, in the morning I'm taking 2 doses, in the afternoon I'm taking 3 doses or whatever. It just as and when. So for instance, my mother or my grandmother in the village will boil herbs or go to the herbal doctor, get herbs, come and boil them. As and when she feels the pain, she'll fetch a cup, she'll fetch some of the content of the liquid into a cup and drink it. So there's no regulation as to you have to take this in moderation or there's an overdose as exists in the modern sector. Now, you also asked a question about the differences in generation. A lot of the older folks prefer herbal medicine. Even the younger people, some people also prefer herbal medicine. And so I think that it is generally family specific. So you may come from a place or a locality or a family which abhors herbal medicine. So there's no mention of herbal medicine in the home. If you're sick, go to the doctor. There is also families who go through the herbal medication first before, if a worst case scenario, they go to a modern healthcare center. So it's really family specific and how culturally you have also been raised to understand the roles each of them play. Yes, so that's what I can say.
All right. Now, just to wrap up our discussion, since you still have the mic, Adwoa, if you've spoken to any patients who've had positive or negative experiences with traditional medicine, could you share one or two examples?
So I've spoken to some Ghanaians, and I must say that majority of them said they prefer herbal medicine to modern medicine. And there was one person who said herbal medicine does not work for her because it takes a longer time to get results as compared to modern medication. So for instance, she speaks about getting pains in some part of her body. And when that happens, she resorts to painkillers. You don't have painkillers in herbal medication. If we do now, I don't know. Maybe Doc can tell us.
When I'm sick, personally, I prefer orthodox medicine because with my sickness, the herbal wouldn't really help me faster. So the orthodox is the best way for me because I mostly get pains. And with pains, I need painkillers, which comes with injection. So I prefer the orthodox.
According to her, she go readily available to maybe the pharmacies or over-the-counter medicines and just get some of the painkillers, which works for her faster than. And she says she has tried the two options. So in her trial, she sees that it works faster for her. There's also the issue. I have not come across somebody who has developed complication from herbal medicine. Rather, a lot of the side effects that people are afraid of getting in taking medicine is associated with modern medication. Like Doc rightly mentioned, when people are taking herbal drugs, the notion is that this is natural, this is coming from our plants, so there is little to no side effect as compared to the synthetic medication in the form of modern pills or tablets that you're taking, which many believe that comes with its own side effects. Yes.
Right. Now to you, Doc, as well, as we wrap up our discussion, do you believe a traditional and modern medicine can coexist in a complementary way? And how can healthcare professionals like you and traditional healers collaborate to improve patient outcomes?
There are a number of herbal medicines used for managing pains. For instance, if we come to Center for Plant Medicine, there's one medicine called MPK. And this is very good for managing menstrual pains or pains associated with menstrual cycle. So there are a number of herbal medicines that are useful for managing pains. However, they believe that it takes a long time to be effective. Is also there. Or we know that herbal medicines are also not, for example, emergency cases, they do also do surgery. Emergency cases are mostly handled by orthodox medicine. But in fact, herbal medicines work from what we have done so far and what we have seen so far. Now, when two systems are in place, they are coexist in a country. In fact, the benefit is very strong and is highly beneficial. For instance, China has incorporated Chinese traditional medicine to the orthodox medicine. The two work together in one system. So these are some of the issues that we need to look at in the country. When we are coexisting these two, make sure that they are coexisting. We have to make sure that the standards are there, there's respect for each other, there's understanding, and the processes are also there. For example, at what time should a traditional herbal medicine refer a patient to orthodox medicine? At what point in time? These are all issues that we need to look at, so that by the time they refer the person is still in good condition that can be taken care of.
Dr. Daniel Boamah, Deputy Director at Ghana Center for Plant Medicine Research and DW correspondent Adwoa, Tenkoramaa, Domena in Accra, many thanks for joining us.
Get the stories that are shaping the continent here on Africa Link.
The future of healthcare in Africa may not lie in choosing between tradition and science, but in finding common ground. As Ghana and other nations work to integrate both systems, one thing is clear. True progress means honoring heritage while embracing innovation. That's it for this edition of Africa Link. Remember, you are not just a listener, but a crucial part of our community, and your engagement can shape the direction of our discussions. We highly value your insights and encourage you to share your thoughts with us. Remember, you can find all of the Africa Link podcast episodes on Spotify and Apple or wherever you get your podcasts from. This episode was co-produced and edited by Isaac Mugabi. My name is Josephine Mahachi. Thanks for listening. Until the next time, it's bye for now.
DW, made for mind.